Hello, viewers. Welcome to season 2 on Sex in the Temple. I want to take this time to thank you, our sponsors. I also want to thank you for those who have subscribed, and I ask that you subscribe more so you can get more content, like and share. Thank you, Omron Media Production. Thank you, Abigail's Signature. We continue with our scintillating, very educative and interactive session on female sexual dysfunction. With me, I have Professor Patrick Amoateng from the University of Ghana, Legon. He's also a youth minister. I introduced him earlier on. I forgot to add the youth minister, so I want to stress it out. So you know Crossway Community Church. I know your friends and your young people are watching, so we appreciate that. Prof, you're welcome.
Thank you.
All right, we go straight into female sexual dysfunction. We want to talk about this. People don't discuss it, but want to take this opportunity to talk about it. What is female sexual dysfunction?
Yeah, so female sexual dysfunction is defined as any sexual complaint or problem from the female that is associated with disorders of desire, arousal, and then also that has to do with the orgasm, and then lastly, when there is pain during sexual intercourse, and if this is able to cause enough distress or some interpersonal difficulties, then that gets it being classified as a female sexual dysfunction. So basically, it is the way the sexual process of a female, if there are some misfunctioning or there are some problems with the way it happens, that would describe the female sexual dysfunction. So basically, there are about 4 of them.
Okay.
So you are looking at one, when there is, there is a problem with the desire.
Okay.
All right. And then there's also arousal disorder.
Okay.
And then when there is a problem with orgasm, usually they are unable to achieve that. Then lastly, when there is pain during sex. So these 4 characterizes what we describe as female sexual dysfunction.
Thank you very much. So what are the causes of FSD?
Yeah, so the causes are multifactorial. You can look at it from the physical point.
Okay.
So with physical, you can look at the medical reasons. So if someone has some cardiovascular condition like the heart problem. Remember when we were talking about the male sexual function, I mentioned that it will involve blood moving
blood
to
flowing,
So the women also have the same thing. Blood must move to the genital area for arousal. And so if you have a condition that prevents blood flow to that area, then that can be a problem. Okay. So kidney problems can also be a problem or a cause. And then also it could involve the outer part of the female genital organ, so the vulva. So if there are issues like if they've done some female genital mutilation, they've cut some portions off, it can affect the way the individual, gets pleasure or goes through the normal phase of sexual process.
Okay.
The other component or the other cause is hormonal. So there are several things that would put the hormones of the female, and that affects the libido. So for example, if there's pregnancy, childbirth itself, and breastfeeding can actually bring down the hormone levels.
Okay.
Usually estrogen levels, if they are low during breastfeeding, then that can affect the libido. Then also menopause as well can also be a cause of female sexual dysfunction. The other one, the third one, which is a major part, is the psychosocial problems.
Okay.
So if the woman has been abused sexually, if she is not in a very good relationship, if she has other social stresses, probably conditions that could also cause mental, issues that will affect her psychosocial functioning, like depression, anxiety, then that can also be a cause for the sexual dysfunction. In this case, they don't even have the desire for the act. And if they are maltreated by their spouses, if there's an abusive relationship, then that can also affect or cause sexual dysfunctions in these women.
Does
So basically,
weight gain, like people who are
well,
slightly obese or?
Yes, obesity is also a risk factor. Okay. Yes, in that it also lowers estrogen levels as well. So that could also affect the way the person would have desire for sex as well. So basically, you're looking at physical, you're also looking at hormonal, you're also looking at psychosocial factors that can cause female sexual dysfunction.
Are there medications that interfere with female sexuality?
Yes, I think I left that out. So there are certain medications that can affect it. Example, if you have anticonvulsants, some antidepressant drugs can also affect the process that the woman will go through to have sex, or arousal, have an orgasm, and then whether they would have pain in the sex or not. So some medications can also affect that.
So it's a whole lot of things that comes together that affects a woman from not just having a desire, but also not being able to reach the orgasm. There's a whole lot of things.
So some, like I mentioned, they are either, structural changes, medical problems that affect it. So when you are managing, you need to approach it from that way to understand what really has caused that sexual dysfunction.
Okay. So are there treatments available, accessible, that on the side of the world we can still, rule out all those things and have that treated? Is there a successful rate? Is it treatable?
Yeah, it is.
Okay.
So the treatment, you can put it into two categories. We have the ones that will not involve drugs. So we can call that non-pharmacological treatment, or probably non-drug treatment. And with that one, you can have several things that you can do. So one is physiotherapy. Mm-hmm. So there are some kinds of exercises, pelvic floor exercises, that have been able to help some women. There are studies that shows about 30% of women who do that are able to, resolve issues with orgasms, and also resolve issues with their, if they have pain during sex, that is also being able to resolve with the pelvic exercise.
Okay.
Then we also have, some talk therapy. So we have sexual, sex therapy, or behavioral change therapy. So with that one, the practitioner would get to understand if there are some behaviors that the couples are having that is actually preventing the woman from being aroused and also having orgasm. Some of them, they are even given certain things they can go home and do, and some exercises that they can do together so that they would focus their sex life, not just on it being just obligatory, but then being pleasurable.
Okay.
So there are treatments like that. And then we also have psychosexual, counseling, where in this case they are looking at emotional problems that actually affects the woman and her probably desiring for sex, and then also going through the process of a healthy sex. So that is also there. And then there are other things that the woman can do. Some go through yoga, some hypnotherapy have been cited as examples of interventions that can help manage orgasm problems in women. So these are the non-drug, treatment options.
Okay.
There is also lifestyle modification, so weight loss, avoidance and or reduction in alcohol intake. If the person is smoking, if the person can stop that, that can also be beneficial. And then healthy, eating diet would also be complementary. Because if you have a healthy body, then you can, of course, if everything is healthy, then sex could also be healthy, depending on the things that you do. So the first point is getting a healthy body. So lifestyle changes are also very important.
So it's not advisable that we just rush and start taking, for the side of the world, if we don't have the money to go to the hospital, we go to auntie behind the door and just get this 1 liter that you drink, this herbal steak that we just drink and we keep drinking.
So I'll come to the drug. So this part that I've just mentioned are just the non-drug, treatments. The drug treatments are also available. The first one that is very common would be to, increase lubrication, especially if the person is having pain during sex. So that one, there are 2 types of it. We have a type called the vaginismus, where there is spasms in the vaginal region, and that makes the vaginal canal very tight. And so during penetration, the woman will experience pain. Then there's another one, which is just general pain, which cannot be attributed to the spasms. So those 2, if there's a lot of stimulation of the woman, so if the woman is using lubricants to be able to stimulate, to be able to make the place so that penetration will not be painful, that can help. So for that, you can use lubricants and vaginal moisturizers. They are available, which can manage that. I think I left something out, which is not medical, but drug. But then also, if you are able to help the woman to stimulate the clitoris, that is also important. So that is part of the non-drug one. So you can achieve that even using some devices. There are specific devices, hand-operated ones, which can help, stimulate the clitoris during the sex act. So the lubrication and all of that can help prevent, pain during sex, and also increase the experience that the lady would have. The other one is you can also have hormonal therapy. So I mentioned that if there are changes in the hormones, that can also affect the way the person desires sex and even enjoys it during the process. So if there's a detection that the hormonal levels are low, then they can do something about it by providing you some drugs that can help you, restore the hormonal balance. Then there are drugs that can also help, increase blood flow to the woman. An example is one of the drugs that is even used by men to treat erectile dysfunction, Viagra.
Women can also take that?
Yes, exactly. It can help, bring a lot of blood into the vaginal region. Then there are other drugs which I may not be able to mention here because of certain reasons. So we are not advising people to self-medicate. So once you go to the hospital and they are able to detect what exactly is happening, if you have sex and there's pain, it's a medical thing that you should be aware of, that you can get treatment for. So all these together, there are even some cases where they have to do surgery. Yes, if there are some problems with the vaginal area that is causing the problem, they will have to probably do some vaginal surgery. So it depends on what it is, and then the treatment will be most appropriate. But when it comes to the woman, it is more of the psychological. So most of the time, if you look at the highest percentage of the female sexual dysfunction, it is basically on the inability to achieve orgasm. So that one will be a lot more, it will be resolved if there's a lot of education between the sexual partners to understand that the woman also needs to achieve orgasm. And so whilst in the act, the man should have the desire that he also wants to pleasure his woman. So that is the highest, that is the one that has the highest. And then the other one is the lack of desire for sex. So all this can be solved basically by talking, understanding, communication, and respecting the other person. So if the woman feels loved and respected, and you give her all that you should do as a man to make her happy, I think the desire for sex would come. And then also, so once that is solved, then the rest would come in.
Yeah.
So it's not everything that can be solved just by swallowing a tablet. There are some things you probably have to talk about them and understand. And then when you do that, it will get better.
So that means you need to create an environment where the communication is very good. Exactly.
So for example, if the lady is having sex and having sex with the husband or partner, and then she's having pain, it should be addressed. That is a sexual dysfunction. So communication, yes. If perhaps maybe there's not enough lubrication, then you should support the woman to have lubricants during the act.
Okay.
If you need to do more foreplay, do it. In fact, that is even important in the act. If you do that, she'll be fully lubricated naturally, and she will not even need lubricants. So a lot of the problems involving the female sexual dysfunction can be solved by communication and education.
All right. Thank you very much. You talked about age. As we age, the hormone decreases. So this lubricants you're talking about, are they accessible? Can we get them anywhere without?
Yes, there are a lot of them.
Okay.
I would rather advise more for the water-based one.
The water-based ones.
Yes, and the oil-based ones.
Okay.
Yes. So they are readily available.
Okay.
They are really available. I mean, I can just say something on top of my KY jelly.
Okay.
They are all available in pharmacies that people can just.
Can you just help us with the application of it? Because I don't want to take it for granted that everybody knows when or what's the exact time that it needs to be applied. So just a guide on that. Maybe our viewers have people who are going through this and they've just had this for the first time and they want to give it a go.
Okay, so I think first and foremost, there are people who genuinely would have issues with lubrication. So for them, I think they would need to do certain things. The lubricant comes in as a support when the place is so dry.
Okay.
So that one is just smearing and then putting it on the vulva.
Okay.
Can help get it inside whilst there's trusting.
So it's only the female that needs to lubricate the man.
The man could also put it on his erect penis. Of course, if some are using condoms, for example, normally when they're using condoms, they can apply the lubricant on the condom.
Okay.
So that is why it's important to have the water-based ones so that it doesn't affect the condom.
Oh, okay.
Yes.
Okay.
So the man can also apply it on his genital and then during the act,
This is after they've had a conversation and identify that pain. It can be pain during penetration or pain just by.
Yeah, so the
pain
first
can come with
so the first thing is that they first of all would have to understand why the woman is not lubricating or having, in the way they say she's becoming wet.
Okay.
Fine. Some people, they need to hydrate a lot because it is all going to be water. It's the mucus that would, get the place wet. So it is water. It is formed from water. So the woman is heavily, really hydrating and taking water.
Okay.
And then also if she is stimulated.
Okay.
So that is a lot of work for most men. You need to stimulate your woman, the foreplay, the kissing, the touching, But they're saying about the woman's skin is about 10 times more than the sensitive than men.
Okay.
So you need to touch her. You need to, you know, invest time
Okay.
in getting her to a point where you can see that she is actually wet. And it's not just at the beginning and then you are just trying to push your penis through her vagina. It would scratch. There will be tearing. You know, so you need to prepare her to get to the mood where she would actually lubricate naturally. If you've done all these and then still the place is still dry, there could be other reasons anyway. But at that point, when you are in the act and you still want to continue, then you can apply the lubricants.
Okay.
So if that is a persistent problem, then you need to understand that there's a problem. So in that case, the two would have to talk about it and probably understand why it is so. Am I not doing enough foreplay? Am I not kissing her enough? Is she even okay in the, like, is she ready? Is she, is the relationship okay?
Yeah.
So sometimes if it becomes more of a duty for the woman, she would always not be like in tune with the act. But if she really wants it, and she's ready for it, you are not abusing her, there's no problem. You have a very cordial relationship with her. You are emotionally connected with her, and she is emotionally ready for the act. Almost every woman should be able to naturally get lubricated.
Yeah.
But even that, if that doesn't happen, then
you need to rule out any other underlying.
Yes. And then also the other one is when men are using condoms or other barrier, like that one would eventually lead to a point where there will be issues. So normally, if you're using condom, it's very advisable you probably have a lubricant in addition.
Okay.
Exactly. So even with the condoms, they put lubricants around them.
Okay.
So some of them have a lot around, but that will not be enough for women who actually have very dry, vaginas during the act.
The reason why I'm just asking questions around, I know a family friend who, because of the abusive relationship that she had with the husband, and she's forced to it's an act, so she just had to do it. It came a point that the husband didn't even have a communication or try to resolve the relationship issues. Just took her to the hospital and say, you need to go and see a doctor because you are dry and I'm tired of it. Yeah, it's only after the conversation now that they find out that there's abuse in this relationship. And until that is sorted out, you can complain and say whatever you say. Her mind is not there. The body is there because he has to perform the act, but her mind is not there. So that's why I'm asking around, is just to ensure.
And usually with the communication, I mean, you would, if you're a man and you really care about your woman, sometimes it's as if it is just my body that you want and not me. I think if you hear that signal,
you know you're in trouble.
You know that you are in trouble. So is it my body? Is it my body you want or me? Sometimes it's very difficult to understand why that question is posed. But that shows that for the woman, it is more of an emotional connection than just a physical act. And I think in the other episode we were talking about just trusting alone is not enough to get the woman to have orgasm. So it is not all physical when it comes to the woman, when it comes to sex. You need the emotional connection. So if you are not treating her well, you have a very bad non-sexual relationship with her, then the sexual relationship will also be affected. So for the woman, everything is connected. A man can separate the two and say, I can treat you bad, but when I want sex, I'll come for it.
So it means that a man can go and cheat and say, I'm really not connecting to this person.
Well, that is also not an excuse.
I'm just meeting a need, but I'm not connected. Because I hear my male friends saying that, I love my wife, but I'm just doing something with this one.
Yeah, that is true about the compartmentalization that men have.
So it's true?
That is true, yes.
Wow.
Men can compartmentalize things. I mean, he can box work in one area, box his family in one, box another in one. So I can deal with my work and come back home and I don't have to connect with that.
Okay.
Or you can insult me as a wife and then, well, if my time is up and I want to have it, whether you have insulted me or not,
the women are
they will still want it. Yes. So they dissociate a lot of things, But for the woman, everything is connected. So once she is good, she is okay, everything is fine. Sex and desire comes naturally. But so everything is connected.
Yeah.
From the morning, what you said to her, how you treated her, and all of that is connected to the sex act in the evening or any time else that you would have it. So to have it with the woman, you should prepare her for it.
Okay.
So once there's a problem, then it will also affect
Yeah.
her sexual function. And that is why a lot of women have, sexual dysfunctions. I think I said somewhere about the prevalence being about 72% or so.
Yes, that's a high percentage.
In Ghanaian women,
Yes, this is just Ghanaian women.
Yes.
When we bring the whole of West Africa together, I wonder.
It may be worse. In Africa, I think the rate will be worse.
Wow.
I think it will be worse. But globally, it's about 30 to 60%.
So
but
that
there are
means
studies that are done.
We contribute a lot from our side.
No, I mean with the way we think.
Oh, okay.
The way we think about sex, that sex is for the man.
All right.
Sex is the domain of the man. And even with issues like female genital mutilations and why they do it, is because it's only for the man. The woman should not enjoy it. So with that understanding, female sexual disorders will be high in our setting unless we change that. That every sex activity or process must end with the two being satisfied. So that should be the goal of partners, that once we are engaging in sex, we should end up all being satisfied. So even if one is dissatisfied, you have to find out why and work on trying to resolve it.
So we need to communicate. We have to listen from a point of understanding. We need to work together so that not only is the sex going to be amazing, but our communication, our intimacy, our emotions and everything will be all right. So we have to end it here, Prof. Thank you so much. Hello, viewers. I want you to understand this. The percentage of female sexual dysfunction in Ghana alone is high. Globally is high. But we need to communicate about it. We need to listen from a point of understanding, and we need to work together to resolve it. If you are a woman out there, don't suffer in silence. There is a solution to it. You can talk to a trusted friend. You can talk to a therapist. You can go to the hospital and rule out underlying condition, and you're good to go. Stay safe. Sex is a gift. Enjoy it. There's a sex in the temple, and my name is Monique.